night for them currently at the moment. So we are working with 3 time zones between Romania, myself based in Paris, France, and then also the Dermapen World team who are based north of Sydney in Australia. For today's webinar, I envisage that we will go for around about 1 hour, 45 minutes. Of course, I would love some interaction. So the chat has been disabled, so it makes it easier for me to answer questions. So if you have any questions throughout the webinar, please go to the Q&A tab and then just simply write your question in. So the format for today is I will go through the launch of the new CBD collection. This will take us around about 25, 30 minutes. Then we will move into the launch of the Dermaceuticals L.E.D systems, which are designed for face, for neck and chest, and then also for the backs of the hands. And this webinar will take us around about just a little over an hour. And then we will move into the questions and answers. Excellent. So I will be sharing my screen, and at any point, at any time, you are more than welcome to take any photos of the material. But please bear in mind that our session is being recorded, and the dynamic team from C.B.D will be able to share this link with you within a few days once we have run it through some edits, and then also you can access the slides as a PDF as well. Let's get started with some screen sharing, and let's begin with our presentation. Please bear with me for one moment as I put the presentation up. Launches the Dermaceuticals CBD collection, but also the new LED phototherapy. The format for today's webinar will begin with the launch of the CBD collection, and then we will move into the LED technology. To begin, when we look at innovations with the CBD collection, this is a newer area to create a more holistic experience as part of your Dermapen procedures. The CBD collection features products available both for retail, but products also suitable for innovative in-clinic use. As such, the attraction of the CBD now creates a new experience of well-being, a new experience of comfort, and a new experience for all Dermapen anesthetic treatments for all of your patients coming to see you. And as such, there's suitability to combine in the new CBD collection in with any aesthetic treatment that you are currently performing, but also the retail range is suitable for all of your patients coming in undergoing their procedures. CBD is a very controversial topic because there is a lot of confusion with terminology between CBD. Is it marijuana? Is this to be smoked? Is this going to be legal, or is this something that's illegal? So what I want to do is first break down the terminology, but then also explore the types of CBD and formulas that we are using in the Dermaceuticals CBD collection. So to clear up the myths, CBD itself is a cannabidiol oil and extract, and this is sourced from the cannabis plant. The cannabis plant is also known as hemp. With the CBD, it can either be produced synthetically or it can actually be extracted from the hemp seed, so the physical seeds of the cannabis plant. The most useful forms or derivatives of the CBD, so we're looking at high concentration, high activity, and high efficacy, are referred to as CBD isolate, but also full spectrum. And these are extracted again from the seed of the hemp plant, or otherwise known as the cannabis plant. To break any misconceptions, the CBD is THC free. And THC refers to tetrahydrocannabidiol. And this is what creates the high. This is what's associated with marijuana. This is what's associated with smoking, recreational drug use, but even the medical uses for marijuana. So because the CBD is THC free, it means that it is non-psychoactive. So this now delivers a safe, predictable, efficient, and reliable extract that can be used on all patients. So the CBD is legal. THC itself, so this is the psychoactive component or extract of the plant. This is what we commonly refer to as being marijuana. So this is a very, very different extract to what we use in the CBD collection. The CBD, of course, is non-toxic. There are a variety of ways to administer the CBD, but likewise, these can particularly be used for aesthetic procedures when applied topically onto the skin, but there is also the capability to apply it sublingually or under the tongue. However, my research indicates that this is not allowed to be promoted for the Romanian market. A cannabinoid, which is another terminology relating into CBD, really refers to any type of chemical that's found within the cannabis or within the hemp plant. And of course, because we're dealing with a plant extract, the CBD is a natural phytocannabinoid, which means that we have a natural extract, which means that it promotes that more holistic effect, particularly for those patients who are looking for an experience, and particularly for patients who serve as part of the marketing demographic where they are not willing to undergo chemical intervention, or they're not willing to undergo injectables or willing to undergo surgical procedures. So we're really able to appease the more naturalist style patient. What's very interesting with the skin and with CBD is that the skin itself contains cannabinoid receptors. And with these receptors, and this includes cells such as keratinocytes, melanocytes, fibroblasts, sebocytes, which are producing sebum, eccrine gland cells, so for sweat glands, and hair follicle cells, these receptors found within these cells actually recognize the CBD. So the advantage of a CBD receptor or cannabinoid receptor within these cells now promotes an effortless tolerance when the CBD extract is applied onto the skin. This means that it is particularly suitable for a highly sensitized, highly reactive, highly volatile skin. So we see the advantage for conditions including eczema, dermatitis, xerosis, pruritus or itching of the skin, but we also see the advantage that this serves following any type of aesthetic procedure, including Dermapen, of course. So due to these receptors, it maximizes absorption, it maximizes affinity within the skin, which now in turn now creates a synergistic effect of topical application, but also high concentration and infusion. When applied topically, the CBD is highly anti-inflammatory, so it reduces the signs of heat, redness, swelling. Likewise, it is very antioxidant, so it is rich in phytoantioxidants. Likewise, it is also abundant in free radical fighters. So with these agents, it furthermore delivers an effect that is anti-pruritus, so it prevents itching, irritation, scratching on the skin. It promotes an overall soothing and calming effect due to its antioxidant activity from bioflavonoids and polyphenols, but it also will support barrier function. This becomes important because by reinstating barrier function, this reaps the benefits to produce an effect of comfort for the skin. So in turn, this is what's reducing the redness. This is what's helping to reduce the itchiness. This is what's helping to take the heat out of the skin. By working in with the natural barrier function, the combination of natural moisture factor, the combination of sebum, ceramides, and free fatty acids, we can also promote a rebalancing effect for excess sebum. So as such, CBD can be used topically on the most oily of complexions, but even on the most driest and sensitized of complexions to enable a rebalancing effect. We also see developments with CBD in a high concentration and extract to produce an analgesic effect. And this is where it can be used as part of your Dermapen procedures, but also as part of any other procedure that you are currently performing in practice. By contrast to an anesthetizing effect, which removes the pain experienced by the patient, so it cuts off how the nerve receptors are then now experiencing that pain. An analgesic changes the experience of this. So, as such, it reduces the sensation, but it also manipulates the experience and how the body refers to and how the body responds to pain. So, as such, as an analgesic, it can be used prior to a Dermapen procedure in place of a topical local anesthetic to now promote not only relaxation, to now promote not only well-being for the patient, but to increase their physical comfort. The CBD extract itself is antibacterial and antimicrobial. To ensure pure concentration, the CBD that's used within the DP Dermaceuticals range includes the isolate, but also the broad spectrum. The advantage of this is not only the high concentration of cannabidiol, but we also see a high concentration of bioflavonoids. This is what creates the physical antioxidant. This is what creates the physical free radical fighting effect, but also contains a blend of phytowaxes, amino acids, and vitamins. So this is what's supporting barrier function, but also enabling affinity with the skin. On the market, there are many types of CBD that are available. And understanding these different forms and types affects concentration, affects purity, but also affects whether this extract contains physical CBD itself. When we look at many common mass market brands internationally, perhaps one of the most well-known extracts from the cannabis or hemp plant is referred to as hemp oil. With hemp oil, it is an extract from cold-pressed cannabis seeds. The only problem is, though, with hemp oil is that there's either no or very, very little CBD or phytocannabinoids found within this extract. So although it's from the hemp plant, it's not containing, if any, CBD. And as such, we can't promote the therapeutic benefits of the CBD with it. For DP Dermaceuticals, this is the reason why we use broad spectrum or we use the isolate extract. The advantage of the broad spectrum is that it's derived in its full from the CBD. And as such, not only do we have the CBD itself, but we have all the benefits of the cannabinoids, which includes the flavonoids, the antioxidant capability, the waxes, the amino acids and vitamins, but also the terpenes with this. With the broad spectrum, it is still THC free. So anything that is psychoactive is physically removed out of this extract so that we can promote safety. But of course, we have a product that is legal. The other option that we also use for high concentration, which also contains some versatility, is referred to as the isolate CBD. And this is a very purified CBD molecule, and it's extracted from the seed, but also extracted from the rest of the hemp plant. With this extract, the isolate doesn't contain other phytocannabinoids as we see within the broad spectrum. So it's a very, very pure form of CBD and a very, very active concentrate of the CBD. So between these two extracts, we are able to ensure purity, activity, concentration, but the versatility for the formulas of the CBD collection used as part of DP Dermaceuticals. To introduce you to the very first product, and this is the CBD Elixir. The elixir is available in 500 milligrams of pure broad spectrum CBD, And it is also available in 1,000 milligrams of broad spectrum CBD. At this point, you're probably thinking, why offer the two? The reason why we offer at two different dosages and concentrations is firstly, there are different laws for different countries globally. For the Romanian market, you will be able to easily use the 1,000 milligram. However, it also delivers option so that in clinic, you may choose to use the 1,000 milligram, but for retail, you could then sell to your patients the 500 milligram. So there are two options, two choices, and two concentrations here of broad spectrum CBD that is cannabis-derived hemp. The elixir is in a capric capriolol base. And this means that it is an extract from a coconut oil. So the elixir has a relatively emollient base. As you can see here, the packaging features a dropper, and then that just simply releases the product. So the elixir has a relatively emollient base. When it's applied topically onto the skin, we have a highly anti-inflammatory response. So it immediately reduces the signs of redness, reduces the sensation of heat, but also calms down swelling within the skin. Likewise, because of the bioflavonoids which are found within broad spectrum CBD and also the abundant phytopolyphenols, we have an exceptionally antioxidant product. This in turn contributes to its anti-inflammatory effects, but also contributes to its response to reduce itching and an uncomfortable scratching sensation on the skin. An advantage that we also see with the CBD elixir that is beyond just topical application is its effect as a proven analgesic. So as such, if it is massaged into the skin topically prior to treatment, massaged for a couple of minutes, the effects, bearing in mind that there are cannabinoid receptors within the skin, cells such as keratinocytes, mast cells, fibroblasts, these are able to recognize the CBD and it creates a natural analgesic effect, which changes the patient's experience to any discomfort or pain. So as such, there are some new protocols as part of your Dermapen procedure. And for those of you who have ordered some Dermapen cartridges recently, you'll notice that there is a new sodalite roller on the end of the needle cartridge. And in the next slide, I'm going to explain how to use this roller with the CBD elixir to now promote an analgesic effect, but a holistic, innovative response to increase patient comfort before any of your aesthetic procedures. The CBD itself, though this is unfortunately not a claim that can be made legally for the Romanian market, can also be used sublingually. So for this, if a few drops are applied underneath the tongue, this now promotes an effect that delivers the feeling of well-being, but also creates a more holistic and comfortable experience for the patient. In turn, this can reduce the sensation of stress. This can also promote a feeling of greater comfort and association with the environment around you. Of course, this is safe because it is THC free. So we are very much at the beginning of understanding just how much versatility CBD can in fact offer, not only as a topical product, but also for lifestyle and also for pain management as well. When applied onto the skin topically, it reduces erythema, it reduces edema. So again, our classic signs of inflammation, but it can also be used following treatments applied as a topical to reduce any discomfort, particularly itching. So if you think following chemical peels, if there is any scabs or escars on the skin, if you think of any laser procedure where there are any scabs on the skin or any major flaking on the skin, the CBD elixir can promote greater comfort, flexibility, hydration, and protection for the skin. And of course, as an innovation for your treatments, when combined in with your Dermapen 4 procedures, pre-op, it can now promote an effective analgesic response. So the versatility of this product sees that you can use it in clinic as a topical product for use before a Dermapen procedure and before any aesthetic procedure to promote an analgesic effect. But it can also be used post-op to soothe, calm, reduce redness and swelling. The patient can also use this at home. So you may choose to keep the 1000 milligram in clinic, but then to retail the 500 milligram for the patient to use at home. And the patient can use this as a facial oil. So cleanse the skin first with the DP Dermaceuticals Tri-Phase Cleanser. If required, disinfect with CliniPrep solution. Apply their usual DP Dermaceuticals serums and correctors. So this could be the Hyla Active, followed by Bright Light. And then before your moisturizer, you can apply a few drops of the CBD oil, the elixir, onto the hands. Massage through, gently press into the skin. And then eye cream and moisturizer, such as skin veneer, can be applied over the top. And then, of course, your cover recover. Otherwise, you can actually just use a few drops of the CBD elixir into your favorite moisturizer. So this works with the skin veneer. This, of course, also works with the DP Dermaceuticals vitamin-rich repair as part of your post-operative care, but can also be blended in with the clearer lotion, understanding that although it's in an oil base, the CBD has an advantage as an antimicrobial, a particular benefit and effect for acne, but also can promote regulated sebum production. So with the base product, all it is caprylic triglyceride, which is extracted from coconut oil. And then we have either 500 milligrams or 1000 milligrams of pure broad spectrum CBD. The versatility to apply it as a topical product before treatments to increase an analgesic effect, but can be applied post-op to now increase comfort, reduce redness, but can also be used as a retail product by patients as part of their daily skin care. And there is safety and efficacy for all skin types, all skin conditions, and for all skin colors. So how do we work this as part of our Dermapen procedure with our brand new needle cartridge? So on the needle cartridge, you will notice that there is a rolling stone. And the stone is called sodalite, which is a mineral-rich stone. So with this new roller stone, this replaces the traditional cap, which was on the original Dermapen needle cartridges. So we now have all caps with the sodalite. The advantage of this is first, you want to cleanse the skin, your tri-phase cleanser, disinfect with the CliniPrep solution, massage a couple of drops of the CBD elixir onto the skin, but then set your Dermapen to the lowest speed, which is speed 1. So you don't want to be operating at speed 4. You want to be operating at the lowest speed. So not 4, speed 1, which is 66 revolutions per second. But then you also want to reduce your needles down to the lowest speed setting, which is 0.2. So ensuring this, then once the skin has been prepared, you can follow lymphatic drainage channels by using the roller ball over the top of the CBD elixir to now promote comfort, an analgesic effect, a lymphatic drainage, but overall increased well-being for your patient prior to your Dermapen procedure. But this can also be used as a combination therapy prior to any other aesthetic procedure that you were using. So essentially for our lymphatic drainage, once there is enough lubrication on the skin with the CBD elixir, then setting your Dermapen to the lowest speed, so 66 revolutions per second, but then the lowest needle depth, 0.2, essentially working from the bottom upwards, from the inside out of the face, we now promote effective lymphatic drainage, but we now also promote a comfortable but innovative way to deliver an analgesic effect prior to treatments. Always before your treatment, ensure that once you have performed this aspect, to remove any treatment residue with some gauze that has been soaked in some CliniPrep solution. Once that residue has been removed, then we just simply spray the skin with CliniPrep, and then you are ready to proceed with your Dermapen treatment. So with this, we have a unique innovation and a unique way to add a more holistic approach. The next product for the CBD collection is the Uber Calm Balm. And this is 125 milligrams of 99.7% hemp-derived CBD isolate. The Calm Balm is the richest product now produced by DP Dermaceuticals. And as such, this oil-rich balm adds instant emolliency, instant comfort, instant hydration, and instantly reinforces barrier function. So this serves as the ultimate salve for minor aches, minor ailments, minor skin rashes or irritations, but also works longer term for exceptionally dry, irritated skin, eczema, dermatitis, psoriasis as well. So this very, very rich, unctuous balm aids to accelerate recovery following any type of procedure, particularly if there are scabs or escars, so following a medium depth chemical peel, following also laser, following IPL, or following any procedure where the skin is going to flake or going to have any scabs as well. The fragrance of this product is abundant in camellia and also lavender essential oils. So it creates a unique, comfortable, but relaxing experience for the client as that is massaged into their skin. Although we have a nice, rich, and emollient base which features sweet almond oil, olive oil, jojoba wax, and beeswax, and camellia seed oil, it creates a non-sticky effect on the skin. So with this can be used effectively as a night cream that is richer and enables greater barrier function. But likewise in clinic, particularly for medium depth chemical peels, you can apply it just on the corners of the nose, so the mucous membranes, on the corners of the lips, on the corners of the eyes to block the peel from covering any of these areas. Likewise, for treatments where you are needing to protect the eyebrows or protect the eye area, you can also use the Calm Balm as an emollient blocking agent. So with 125 milligrams of 99.7% pure hemp-derived CBD isolate, we have a product that delivers, of course, an overall anti-inflammatory and antioxidant response. The blend, including the camellia oil, but also including jojoba, reduces the signs of inflammation, particularly following ultraviolet exposure. It can be used every day. I recommend at nighttime due to its emolliency, so that in the daytime, a lighter product such as skin veneer or vitamin-rich repair or even the clearer lotion ensures that makeup adheres to the skin effortlessly. And of course, it's suitable for all patients, all ethnicities, all skin types, but will be appreciated by patients with particularly drier skin. And of course, a safe formulation that is pure CBD, that is THC free. The advantage of the Calm Balm is that it can be used for dry, rough cuticles. It can be used as a lip balm. It can be used for cracked elbows, cracked feet, cracked knees, dry, flaky, irritated, itchy skin as the ultimate short-term salve, but also as a longer-term corrective and moisturizer to reinforce barrier function within the skin. Continuing on the theme of hydration is the CBD Visage. And the CBD Visage is 500 milligrams of 99.7% hemp-derived CBD isolate. So with the Visage product, this is a moisturizer, However, this moisturizer features blue light capability to reduce the effects of blue light damage on the skin. You're probably wondering what blue light is. Well, what's illuminating me at the moment is blue light behind my computer screen. Likewise, as I look into my computer screen and look into the camera to talk to you today, it's emitting blue light. Every time I'm on my phone, it's emitting blue light. You watch the television, blue light. You spend all day in front of your computer, in front of a tablet, all of this is blue light. So we understand as part of the spectrum of color that blue light is sitting very, very close to ultraviolet. And so as such, blue light can deliver just as damaging free radical attack, contributing to skin breakdown, contributing to wrinkle formation, thinness, irritation, but also sensitivity. What creates the perfect treatment to counterbalance the blue light is a specialized complex that is called LumaFuse. And the LumaFuse is a combination of a pea extract combined in with glycerin. And what this does is reduces the effects of the blue light. It protects the skin with a similar protection that we see like a sunscreen, but this uses the pea extract in order to do this. The advantage of the Visage is that this works suitably as a retail product for use by the patient at home, particularly for ongoing sensitized skins. So think rosacea, dermatitis, eczema, psoriasis, or chronic xerosis or dryness of the skin. So this effective moisturizer, particularly for irritated, sensitized skins, also works well as an urban product. So for the modern patient, the modern practitioner who's working in a highly polluted city environment, working in an office and coming into contact with blue light every single day. And of course, the active ingredient also features 500 milligrams of the CBD. Where the Visage now increases its penetration and activity within the skin is it contains not only the triple molecular weight LumaFuse complex as featured in all corrective DP Dermaceuticals products and also the MG collection, but it also features the calphosome or the calcium phosphate technology. These two agents increase delivery, increase affinity, but also concentration and potency of the active ingredients. So combine that in with amino acid rich aloe vera, with highly antioxidant vitamin E, with raspberry extract, with shea butter, green tea, and also the pea extract, we have the ultimate treatment for dry, irritated, sensitized, urban modern skins exposed to chronic blue light. This is now supported with our second eye product for DP Dermaceuticals, and this is the Cbd-Rer Eye Cream. And it contains 125 milligrams of 99.7% hemp-derived CBD isolate. The RER eye cream continues on, as with the Visage, with a combination of not only the CBD, 125 milligrams, but of course the delivery mechanisms and systems of the LumaFuse, triple molecular weighted hyaluronic acid, but also the calphosome or calcium phosphate technology. Now combined in also with vitamin C and with argan plant stem cells and also with camellia, we have a potent cream that is rich and protective without feeling heavy. Eye makeup sits flawlessly over the top. It does not create an uncomfortable, greasy sensation or irritation to the eyes that can be used particularly for deep wrinkles, for superficial wrinkles, thin skin, but also to reduce the effects of darkness, puffiness around the periorbital eye area. So as part of the patient's daily skincare, wash with triphase cleanser or even the clearer foam cleanser, apply their corrective serums from DP Dermaceuticals, Bright Light, Hyla Active, Retinol Active. They can then apply a few drops of the CBD elixir, then a small amount of the RER or Rapid Eye Restore Eye Cream, and then followed by the Visage during the daytime, and of course Cover Recover. And then as part of their nighttime regime, the CBD Uber Calm Balm. So this is the CBD collection, new from DP Dermaceuticals, and this is a new holistic way at looking at client experience, patient comfort, but now delivering a modern urban solution for the modern patient with modern skin concerns from irritation, sensitivity, dryness, itchiness, and volatility. But of course, as part of hand-in-hand synergy of solutions with your Dermapen procedures, but also with your other aesthetic procedures, we have effective pre- and post-operative care. Moving on to our second topic of the day, it is with immense pleasure that I launched the synergy of LED or light emitting diode with Dermapen and DP Dermaceuticals. And this is to launch the DP Dermaceuticals L.E.D technology, an illuminating experience for every patient, for every treatment, for every indication, every time. We understand and we know that the modern patient wants to take a part of your knowledge, wants to take your products, and wants to take your expertise that you deliver in practice and in clinic and to be able to use this at home. So it's quite simply like having an aesthetic doctor on call for the patient. Ways that we can encourage this includes not only using retail home care and similar products that can be used in clinic, such as the classic DP Dermaceuticals, the CBD collection, but also the brand new LED from DP Dermaceuticals, which can be used in clinic, but can also be retailed as an at-home product for the patient to use. What we are delivering as a first is LED with twice the light. The LED stands for light emitting diode. The technology, of course, is clinically proven. It is medical grade with the CE mark for cosmetic, but also with FDA medical registration. The products can be used for both clinic care, but can also be used as patient home care at home. You can make the decision for your clinic and you can make the decision for your patients as well. Twice the light refers to that the light emitting diodes have both 633 nanometers red light, but also 830 near infrared light coming through. So these two wavelengths is what delivers not only twice the light, but also twice the benefits as well. The masks themselves are extremely lightweight and flexible. The masks themselves are also easily recharged. So we have a USB charger here with a lithium battery, and then that just simply plugs into main power. There is a medical grade silicone, which attaches easily onto the face, and then of course elastics, which repositions everything and holds into perfect position for every patient undergoing every procedure every time for twice the light, twice the rejuvenation, and to enhance and to complement all of your procedures, both in clinic, but also as part of at-home care. Of course, rechargeable power and a flexible medical grade silicone ensures safety and also purity. The LED technology is unique because it is non-ablative, but it is non-thermolytic. So as opposed to a classic light bulb, or if you think of thermolytic procedures such as laser, such as IPL or radio frequency, there is no heat being emitted from the LED, which ensures and guarantees safety for all Fitzpatrick skin types, but also for all ethnicities as well. The technology for the DP Dermaceuticals L.E.D is patented, and we offer 3 options of L.E.D technology, which includes the face. There is also for the neck and chest. There are adjustable straps here, so this can be held quite high or lower, but likewise also this can be used for rejuvenation of the scalp, and we even have an option for LED rejuvenation that treats the hand area as well. So having 3-in-1 technology now allows for rejuvenation for all body parts and all body areas as part of your aesthetic treatment program with your patients. Photodynamic therapy, or the origins of using light for aesthetic benefits, has a history which dates all the way back to the 1890s. And we actually begin with the work of Niels Ryberd Finsen from the Faroe Islands. Ryberd Finsen had been struggling ongoing with a hereditary skin disease, and as such noticed that when he was in direct sunlight, that it enabled some ease, some greater comfort and capability for him. This led into his development for photodynamic therapy, or lights. So he's actually viewed as being the founder of modern phototherapy. So as such, his success with lupus vulgaris, which is dermal granulomas with a necrotic center, which came from tuberculosis complications, and although that this is not going to be something that we experience in modern times, what he saw and what he was able to succeed as the founder of modern phototherapy was the effects of light in photobiomodulation on skin functionality, skin correction, and skin rebalancing. This work then became redeveloped in the 1960s by Alvarov. And Alvarov at the time was based in the Soviet Union. And what he began to revolutionize was LED development, but he was taking this a step further by using semiconductor heterostructures. And as such, what he was able to do was create the development of pre-laser, of pre-LED technology, and then use that into further developments, particularly into solar panels, into full laser technology, and then into LED technology as we know it today. This then led into further developments similar time period in the 1960s from Andrei Mester from Hungary. And he's also known as one of the fathers of photobiomodulation. And what he developed was referred to as photostimulation. And this was with a device called LILT, or low-level laser therapy, and LED. So understanding that a low dose of non-thermolytic light, similarly to photosynthesis, was able to promote a chemical cascade within the skin. And as such, he was using this low-level light therapy, or cold light, for the treatment particularly of pre- and also active skin cancers. So the mechanism of action, or the power of this light energy, is very similar to photosynthesis. So we have sunlight being admitted onto a plant. The sunlight then activates photosynthesis. So the light is turned into an energy source, and then this chemical energy source then begins to fuel growth and development. So from sunlight, we then see the effects of activation of chlorophyll via photosynthesis, and then a development and growth of plant tissue. For human skin, however, the light works in a similar mechanism. So we have exposure to the light-emitted photons from the LED itself. And remember that the physical wavelengths we are using ensure that the skin is not burning, there is no risk, there is no element of damage. So you can see that I don't need to wear goggles. There's also absolutely no heat with this technology. What the biostimulation now creates is a molecular chromophore photoreceptor, which then acknowledges the physical presence of the light. And in turn, that chromophore, once absorbing that light, then begins a chemical process of intracellular photobiological reactivity, which means that we create and instigate a chemical cascade within the skin, which now promotes a benefit. So having a look at a simple summary to enable an understanding of how the light works, why we're using light, but why we use a non-thermolytic LED. So exposure to the light penetrates into the subcutaneous tissue. So we understand that even if the light is applied topically, it's able to penetrate deeply into the skin. Mitochondria, so similarly the brain of the cells, are absorbing the light and absorbing this energy to now create a chemical energy. What this does is then activates and stimulates the mitochondria to produce more ATP, or adenosine triphosphate. Adenosine triphosphate is essentially our exchange of intercellular energy. So it's a currency of exchange, a currency of energy, and a currency that now enables a more rapid stimulated response within the skin. In short, we're encouraging cells to look, act, feel, and behave as if they were a lot younger and a lot more active. The benefits of this is the light now promotes intercellular exchange of communication. Better communication means better functionality, but better communication also encourages better integrity of the skin itself. We also promote microcirculation of blood. So in turn, this delivers a more effective oxygenation, delivery of growth factors, delivery of appropriate balanced hormones. But in times of crisis or inflammation, this also works to assist and control the process of angiogenesis. So overall, we're now promoting better cell production of happier, healthier cells. We're now including and now encouraging better circulation within the skin. Stimulation as such now also enables stimulation of fibroblasts, which produce collagen, elastin, glycosaminoglycan, and also glycoproteins. And in turn, we now accelerate the wound healing response and now encourage an overall healing and repair process. So why, of all the options, of all the rainbows, have we decided and chosen to go with red at 633 nanometers, but also near infrared at 830 nanometers? With the red light itself, it promotes a cell reproduction. It also activates the fibroblasts. So the fibroblasts, in turn, feature at around about an 87% concentration within the dermis and around about a 5 to 7% concentration found within the hypodermis. Fibroblasts are responsible for production of four things. We have collagen, elastin, glycosaminoglycan, or chains of polymucosaccharides, hyaluronic acid, and then also glycoproteins. So the activation and stimulation of the fibroblasts increases the integrity of the extracellular matrix, increases hydration within the skin, now also increases circulation to the area, which in turn now promotes and activates better integrity, better functionality, but also a faster healing response. The red light, of course, is visible to the naked eye. This is what you can see here. With the near infrared, it presents as a very, very small glow. So by comparison to infrared, which is not seen by the human eye, the near infrared presents as a very, very minor red glow. The advantage of the near infrared at 833 nanometers is that it is a deeper penetration into the skin. Similarly to the red light, it increases cell reproduction, so happier, healthier cells reproducing further happier, healthier cells for this. In turn, it can also encourage more effective wound healing, and this indicates right down into discomfort and pain within the body, within the tissues, but even right down to the bone. But for purposes of this webinar, I will focus on the aesthetic benefits. So an increase of wound healing and acceleration, particularly for the skin itself. particularly through circulation and wound healing. This can also serve to promote a benefit and effect for hair regrowth and stimulation as part of a synergy of solutions and combination therapies for patients affected by alopecia. There are many options of colored light, and when we look at the rainbow of spectrums, the question needs to be asked, why have we chosen to go with 633 nanometers red light, but also 830 nanometers of near infrared? We need to have a look at the technology of LED and how that's developed over the last 20 years, but we also need to have a look at the clinical evidence of what works and what doesn't. So as we develop upon this topic, we understand that LEDs, by their very nature, are only generally programmed to one wavelength. Over the last few years, the technology has now been able to see a combination of wavelengths from a single LED, and the benefits of this is combining red at 633 plus the near infrared at 830 nanometers to create a complementary effect of biostimulation via the photons and also via the light. So this complementary effects between the red and the near infrared ensure that you are seeing efficacy. If we look at a rainbow of colors with devices which are using green, blue, yellow, then moving into red, then adding in near infrared, adding in violet, with all of this rainbow of colors here, isn't this somehow going to deliver more benefit for the skin? Well, not at all, because if the energy of the device is being divided to so many different colors, then it means that the output for the key wavelengths, which is red and near infrared, the wavelengths which work, is going to be significantly compromised. So in other words, we need to assess that not only the right color is being used with LED, but we also need to make sure that it's got the right energy delivering that, but also the right time exposure. So a quick flash of light isn't going to do the trick, but a longer term exposure to the light of the right light at the right energy is what now ensures the ultimate of exposure and the ultimate of treatment. And this is why we have the proven technology of 633 nanometers red, 830 nanometers near infrared. Let's get a little bit more scientific at this point. What exactly is happening within the skin, physiologically and biologically, when we expose it to the near infrared and to the red at 633 nanometers? So we refer to this as a photobiochemical reaction. So light activating a biological response, and then this creates a positive chemical cascade within the skin. So first off, the light is emitted by an elementary particle. And in this case, the energy releasing photon is an LED, which is emitting both red, but also emitting the near infrared as well. The light becomes absorbed by a chromophore. So this is not dissimilar to pigment laser or to hair removal laser, where it becomes attracted to darkness in order to activate that response for pigment or hair removal. The chromophore in this case is a porphyrin. Likewise, it can be flavins or any other light-absorbing entities which are found within the mitochondria or the brain physically within the cell. So when we look at this within that physical mitochondria, key agents as chromophores include cytochrome C oxidase, which has 2 copper elements, but we also see the benefits of the light being absorbed by plasma membranes. So the light is recognized, the chromophores accept that light, and then the chromophores now acknowledge and absorb that light to now promote the photobiochemical response. This begins within the skin with production of ATP, or adenosine triphosphate, the currency or the exchange of energy within the skin. What this does is then creates a reactive oxygen species and nitric oxide responsive stimulation. So this in turn is now going to create and promote better circulation, better oxygenation for the skin, but also a better delivery mechanism, particularly for nutrients within the skin. The process now promotes a better intercellular signaling. And what this means is that if the cells are communicating more effectively, we open up the opportunity for a more efficient and a better running workplace. So if you can imagine your day-to-day workplace without a telephone, without email, without social media, without a computer, without a fax machine, without a carrier pigeon, no communication, it's going to be very difficult to create efficacy of work and getting a job done. So through the ATP and then through the stimulation of intercellular signaling, this is now creating a more efficient workplace physically within the skin. So as such, we now get an activation of the transcription factors, which are responsible for cellular proliferation and differentiation. So in other words, we're now promoting the healthy, happier cells to undergo mitosis, to reproduce further happy, healthy cells. We also promote a process that is anti-apoptosis. So it extends the life of these healthy cells so that they can reproduce more effectively. But we now promote further tissue regeneration and also a process of repair activation. This then leads into the role, particularly of growth factors and also the role of cytokines or signaling cells. So we see the release of interleukin 1 beta, and this is a cytokine cell, so a communicating cell that's opening up the lines of communication and opening up the lines also for intercellular messaging as well. But we also get a stimulation of tumor necrosis factor alpha, again, another cytokine or cell responsible for communication. As this increases, this now leads to the release of regulated matrix metalloproteinases. So an MMP or matrix metalloproteinase is traditionally activated following major trauma. The MMP is responsible for the release of 2 major enzymes, which is collagenase, but also elastinase. And the role of these under a standard wound healing response is to enable collagen modulation, but also remodeling. If we have too much collagenase and elastinase, we see attack of the collagen, an abnormal healing, and an abnormal extracellular matrix. However, if we can promote a rebalance of matrix metalloproteinases, in turn, that corrects collagenase and also corrects elastinase within the skin. So as such, we now begin a process where old damaged collagen becomes replaced and activated by new collagen production. And particularly with LED technology, this normally begins with type 3 collagen. And because of this is the reason why more regular treatments over a longer time period are encouraged to ensure efficacy. So the ultimate combination of non-traumatic LED in conjunction with your Dermapen, which activates a controlled microtrauma via 1,920 puncture channels per second, now serves as the ultimate collagen modulator. What we also promote is light-induced tissue inhibitors of matrix metalloproteinases now also enable the protection of the collagen from proteolytic damage. So this means that collagen, the most abundant protein found within the human body, now becomes reinforced, now undergoes a process that protects it, stops its degradation, but also promotes better efficacy and also preservation of this. As part of the dual light system, we create a fast absorption peak via the red light, which is 633 nanometers. But then this becomes reinforced. Then this now becomes a part of a second peak, which is activated with the release of the near infrared at 830 nanometers. So from the technical side, let's now make the process a little bit easier to further understand why our device is working and why you will want to choose the DP Dermaceuticals L.E.D as part of your autologous regenerative procedures. Let's take into account some principles and physics for biostimulatory effects. So the basics, the core of what's going to make it work, why it's going to make it work efficiently, and how to maximize your procedures and to get the best out of it. So in other words, what you should be looking for to ensure that you have the ultimate of LED technology. The first consideration is wavelength, the color of the light. We see devices out on the market which utilize white light. Well, white light, that should contain all aspects and all colors. White light is currently what's illuminating me now. But because that white light is generalized and it's not concentrated, there's no benefits out of this. We also understand that of the rainbow of colors that you could choose from, the two colors which have the most research is going to be red light at 633 nanometers, near infrared at 833 nanometers, but also blue light. But I will explain the blue light in a few slides' time. In addition to ensuring that you have the right color, so the right wavelength, you need to make sure that you have the right intensity. So this means that you need to have enough photons and enough dose at enough power to ensure that it's going to activate cell function. And a huge area for consideration for this is time period. You can't just flash on and flash off and expect that you're going to have your full result. So we understand that the intensity is not just about the power, the energy, the number of those photons, but the intensity is also about the time period of exposure itself. With this energy, we look at the total energy delivered within the treatment time period, and this is referred to as joules per centimeter squared. So again, we've got to understand that the placement of the LEDs, the intensity and the power is what contributes to its beneficial effects. This is why we have this very close placement, but this is also the reason why we take into account the travel distance, which is referred to as inverse square law. Since the very creation of the first large aesthetic platform devices for LED, the biggest challenge has been trying to get that platform device as close to the skin as possible. The farther away the light source is, then it loses its energy. And this is referred to as inverse square law. So we understand that the intensity of the LED decreases as the distance between the skin and the light source now increases. So we can either be close or the further away, we now lose our physical power. So inverse square law is stating that with intensity, that the distance of the source of light, how close or how far away, is going to determine how effective your exposure and determine how effective your treatment is going to be. Farther away the light source, the smaller the exposure is physically going to be. So we see the challenges of traditional platform devices which don't conform to the contours of the face and don't conform to the contours of the scalp, but also with the body. So mathematically, if the light source is 2 times farther away from the skin, your intensity or the power becomes reduced by some 25%. That's massive. But we consider also if the light source is 10 times farther away. So we look at a traditional platform device where it's not physically touching the skin, your intensity reduces by around about 100 times. So with the DP Dermaceuticals L.E.D technology, it's delivering 18 joules in just 10 minutes of time period. But we understand, however, because of the contour of the medical grade silicone, that it is physically sitting on the skin, not above the skin like a traditional platform device. Then with those 18 joules in 10 minutes, an accumulative dose, so multiple treatments of around about 3 sessions per week, is going to deliver 196 joules of power in a simple 4-week program. So this now takes us as a leading powerhouse of LED technology, but the simplicity of the wraparound contoured medical grade silicone. So by comparison to a platform device, the closest it's going to get to the skin is the part which sticks out the farthest, which is going to be your nose here. So this means that there's going to be issues for the furrows of the under cheek area. There's going to be issues for the periorbital area and also around the chin and jawline. So the concept of being able to contour and mold and now have the product physically touching right on the skin and then being able to adjust the straps even tighter now ensures that as part of a treatment program with increased frequency and exposure, that we can deliver more dramatic results and a more dramatic response with greater power, but also greater longevity within the skin. The first mask is the face mask, and this contains 66 bi-wave, so red and near infrared LEDs. Each LED is 4 millimeters squared, and they are spaced between 5 to 20 millimeters apart. The wavelengths, of course, as with all the products, are red light at 633 and near infrared at 830. The intensity or the output of the device is 30 megawatts per centimeter squared. So with 30 megawatts per centimeter squared, bearing in mind that the intensity of this power intensifies and becomes stronger because the device is sitting on the skin directly, not above the skin like a traditional platform. So in just a 10-minute time period, the physical energy is being delivered is 18 joules per centimeter squared. So we understand that the more treatments, the greater the energy, the more joules, and the greater the benefit is going to be. So some 196 joules per centimeter squared in just a 4-week treatment program with no other combination therapies. With the travel distance or the inverse square law, it's 0 millimeters because the lights are sitting on the skin, not above. And the mask material is a very, very flexible medical grade silicone. And with this, it means that it can easily be disinfected with CleanPrep solution. Likewise, also, it guarantees safety and efficacy if you're using this in clinic between patients. The next option that we have is the neck and decollete mask. And the neck and decollete mask features 54 bi-wave. So we have both red light and also the near infrared. And the LEDs in this case are 3 millimeters squared, and they're spaced between 5 to 20 millimeters apart. So the wavelength, 633 and 830. The intensity is the same. So we have 30 megawatts per centimeter squared, and this is delivering 18 joules per centimeter squared in just a 10-minute time period, sitting right on the skin. There's 2 options of straps. So with the straps, you can apply it for the chest area, but the straps also enable you to apply it higher up around the neck and also for treatment of the upper décolleté. This mask also can be used to treat around the scalp area as part of your combination therapies for alopecia. So we can see the benefits of this treatment, but also the versatility by simply adjusting the straps. And there are multiple straps which are contained when purchasing with the boxes, which contain everything that you need, as well as the correct power adapters to recharge the lithium battery as well. The final option and choice is for the hand. And the hand features 66 bi-wave red and near infrared LEDs. They're 3 centimeters squared and spaced between 3 and 12 millimeters apart. Same intensity, same light source, and same inverse square law, and same when it comes to medical grade silicone production. So extremely flexible. So the hand simply goes in, and then that is put into position via the Velcro straps and left in for a 10-minute time session. The on-off button is just at the back here. So we now see innovation. So the power source is a rechargeable lithium battery. So that connects in via a USB, and then that will connect in just to mains power. So when you purchase the device has an option for all major plugs. So your European switch is available and easily connects in. So it charges very similarly to a mobile phone. The mask material is a medical grade silicone. So cleansing is just as easy as using the Cleaner Prep. But I will introduce you to some further products which will physically create a barrier in between the mask, but also in between the patient's skin. The output intensity, 30 megawatts per centimeter squares, but this is actually reached within seconds. So as opposed to a much larger platform device, which has to work its way up. So I want you to think of a light globe in the house or even in your bathroom. You turn the light on and it needs to take a minute in order to get to full light. This is achieved within seconds with the DP Dermaceuticals. Likewise, also the output wavelength is a dual effect of red 633 and near infrared at 830. The dosage range is preset, so you do not need to change the dosage. It ensures always that you have maximum power and maximum effect. The lifespan for each individual device is thousands of hours. So we have at least a 5-year minimum with each of the devices as well. The treatment times are preset. So once you push the button, it is exactly 10 minutes. But of course, you have the option to do a double session. You can do a triple session if you want, but a minimum of at least 10 minutes with this. The standard dosage per treatment is 18 joules per centimeter squared, but obviously we increase that energy and exposure throughout the more procedures and treatments that we undergo. There's 2 published clinical studies exactly on this device. The technology comes from the same origins as the Omnilux Revive. So it is the same crew who have developed the original LED for the aesthetic market, which is Omnilux, who are also behind the development, the study, the research, and the production of the DP Dermaceuticals L.E.D. As such, it has the registration for the CE cosmetic, but also FDA medical. It is patented technology under the same patent as Omnilux, and there is also a 2-year warranty with the device. At this point, you're probably thinking back to trainings of long ago with myself, where the question of LED and Dermapen procedures, can it be done? We've in fact changed our tune with this. Why have we changed our tune, and why are we now enforcing and why are we now promoting the benefits of LED? We've been watching very, very closely since the creation of the first Dermapen, and as the inventors of automated microneedling, Dermapen World released the world's first Dermapen back in 2010 in Sydney, Australia. Since the release of the first Dermapen, we've been watching very, very carefully the role of LED. We've been watching very, very carefully the role and response, particularly of icing the skin after treatment, and also using steroid creams following the treatment. So we understand that the philosophy for a Dermapen procedure is very simple. We are activating a controlled but resolved wound healing response. When you have a controlled and resolved wound healing response, we're activating inflammation, so pain, heat, redness, swelling, loss of function, which then moves into a process of proliferation, regulated collagen deposition, and also angiogenesis. As part of a successful inflammatory response, what we see is the release of regulatory growth factors. But what we also see is the role of chemotaxis and phagocytosis, white blood cells being able to remove pathogens within the skin, as the associated growth factors from epidermal growth factor, transforming growth factors, keratinocyte growth factor, melanocyte growth factor, and the growth factors managing vascular activity, vascular endothelial and platelet-derived growth factors. We understand that these are paramount as part of the inflammatory response. So we always considered, since the first Dermapen device, that if we were instigating a controlled but resolved inflammatory response with Dermapen, and then an agent was then applied to reduce that inflammatory response, then arguably we would lose a lot of the power and effect that we tried to stimulate, and therefore we would reduce the potential of growth factor proliferation. We would reduce the potential of chemotaxis and phagocytosis, and as such, it would interrupt the treatment and reduce the effects of Dermapen. However, we've had a change of tune, and we've been looking at the clinical data and evidence-based data since 2010. And following this information and following the scientific trail, we've now discovered as more recent information as new as from 2020 now has encouraged us to rethink and to change our tune and to follow this scientific trail. So when we looked at Dermapen back in 2010 with Dermapen 1, when we looked at Dermapen 2 in 2012, we never would treat conditions such as rosacea. We never would treat conditions such as acne or vitiligo. However, in 2020, we know and understand that there is success with Dermapen and with these indications. So just as we've developed with the indications with Dermapen, we've developed with the combination therapies of Dermapen, but also with LED technology. When we look at the studies from Birch, from 2020, what Birch has discovered is that the red light at 633 nanometers and the near infrared at 830, it's absorbed by the cell components. What this is now doing is leading to an increased cellular proliferation as part of a combination therapy. It's triggering further collagen, but also further elastin production as well, whilst promoting better angiogenesis and oxygenation, and of course the release as part of the phototherapy of the instrumental ATP or cellular energy. So what Birch noticed is that this is now promoting a smoothness of the skin. It's promoting a reduction in wrinkles, better moisture retention, but also an evening of skin tone, so even for hyperpigmentation. So as part of a combination therapy, we're now understanding that LED is in fact enhancing the controlled and resolved wound healing response instigated by Dermapen, as opposed to reducing its physical potential. When we look at the work of Russell and Kellett from 2006, and this is the study that's the oldest technology, but what we understand from this time period is that particularly with the near infrared, it's accelerating fibroblast activity, but most importantly, fibroblast transformation. So from the immature type 3 collagen, we now see a greater transformation and development into stronger, more resilient type 1 collagen. So we understand that the combination therapy of near infrared with LED, but also the activation and stimulation of collagen from a Dermapen procedure is enhancing the chemotatic and phagocytic activity of leukocytes and macrophages, but now also allowing not only for better phagocytosis, but better collagen placement and better collagen transition as part of the combination therapy. Looking at the work of Schull and Mulholland from 2011, they discovered that the application of 633 nanometers was in fact encouraging a faster wound healing via increasing pro-collagen synthesis. So we understand that LED is promoting a collagen production, but the dual effect with Dermapen, which is creating collagen production via a mechanical means, as opposed to a photobiochemical means with the light here, what we're getting is a high release of fibroblast growth factor. We're now getting a stronger response and communication between affected lit macrophages, which are now communicating more effectively with the physical fibroblast itself. And as such, wound healing now becomes accelerated. So we understand that we can also achieve a faster repair response following a Dermapen procedure, reducing patient downtime, but also increasing their comfort whilst promoting increased collagen synthesis. From the work of Ablon in 2018, further supports that the LED has anti-inflammatory effects that is now also enabling an increase of the action of wound healing cells. So as part of this process, what Ablon has discovered is that particularly during the inflammatory response, but then the remodeling phase, which is the maturation phase or the third phase of wound healing, that the LED is now encouraging a better communication, better release of wound healing cells, and a more effective cascade. And finally, the work of Garca, Mamalis, and Jagdeo from 2015, what they're noticing, and this is key, particularly for your scar revision work, that the near infrared may actually help to modulate transforming growth factor beta, which is responsible as a profibrotic growth factor for guaranteeing abnormal collagen deposition, hypertrophic, and also keloid scars. So with this up-to-date technology, which really ranges from the time period of Dermapen, and with the most recent studies being from 2020, you can understand why we've decided to now commit to a new method, a new way to deliver better results. One area of concern with patients is the confusion between LED light-emitting diodes, by comparison to laser, by comparison to other light sources, even the basic sun, that you shouldn't look into it. The LED that we have is tested to an international standard, and this is as part of the process for the FDA medical registration. And as such, we can guarantee the eye safety. So as you see, this is numbered, this is registered. This is also part of the FDA registration for this. So the Dermapen DP Dermaceuticals L.E.D has both FDA medical, but also CE cosmetic as well. So the LED at 633 and at 800 nanometers guarantees and ensures that there is absolutely no harmful UV. So your patients can actually keep their eyes open during the procedure. It is not a problem. My suggestion is to have a well-lit room, which means that the contrast is not so great. If your room is very, very dark as the patient is undergoing the mask, there's going to be greater contrast with the darkness and the light, which can mean that the light can feel a little bit bright. So no protective goggles are required, but if you choose, it is not a problem if you choose for the patient to wear them, or whether you choose for the patient not to wear them as well. In reality and further safety, there's absolutely no peer review paper that's been published for the effects of LED on pregnant or breastfeeding women. And whilst we understand that any harm is going to be completely unlikely, just always go ahead with the patient's doctor's permission before proceeding with any type of aesthetic procedure. I touched on one other light color or wavelength before, which is blue light. And you'll notice that blue light is undergoing a little bit of a revolution in the market at the moment. And this revolution all links back to its ultraviolet and also its effects on the eyes. So the purpose of blue light as a traditional acne treatment is that the blue light was clinically proven to kill P. acnes bacteria. However, there are other products which are also proven to kill P. acnes bacteria. This is both the DP Dermaceuticals CliniPrep solution, but also the new MG collection, Clear Up. Further studies, though, which are up to date from 2020, show that P. acnes bacteria is sensitive to light. So we understand that it lives and thrives in an oxygen-free environment for this. However, it's also sensitive at red light at 633 nanometers. So when we expose the skin, so acneic or seborrheic patients, to the red wavelength, it also activates a process which causes the bacteria or the P. acnes to self-destruct. So it's delivering oxygenation for this. What it also does with the red light, which we don't see in blue light, is a better process to reduce inflammation and a better process to also enable faster healing and repair. So we understand that, yes, red light does have the capability, as does blue, to enable oxygenation and to enable the destruction of P. acnes bacteria. But as opposed to the blue light, We understand that red light is more superior in reducing the associated erythema, the associated edema and inflammation, but also promotes better recirculation for the skin. So for acne patients, why not disinfect the skin first with a layer of CliniPrep solution, then apply a few drops of the MG Collection Clearer Mesoglide onto the bare skin, and then apply the DP Dermaceuticals mask and leave to activate for 10 minutes. So the advantage of this is that this combination therapy allows for peak absorption of the anti-acne actives, which is the CliniPrep MG Collection CLR or Clearer. But what it also does is enables a better healing, repair, and reduction of inflammation by comparison to blue light, with complete safety for the eye area. Now let's look at ways to upgrade our LED technology. The first way you can upgrade your LED technology is a new type of mask produced by DP Dermaceuticals. And this new mask is referred to as the LumaFuse Hydra Gel Mask. There are two of these. There is one produced for the face, and then there is one also produced for the neck area. So these will work for both the face mask and then also for the neck and decollete mask. We have yet to produce one for the hand area. Otherwise, you can also look at applying a very thin layer of the MG Collection HA35+, a couple of drops, or even the standard Hyla Active underneath. But for the best effects that are also clinically proven as part of our research, have a look at the LumaFuse Hydra Gel. So the Hydra Gel has been specifically designed to allow the LED rays to penetrate through the skin. That is why this mask is specific for the LED. So you cannot, under any circumstance, replace or substitute this with any other mask. So you cannot use a cream mask, you cannot use a gel mask, you can't use the traditional DP Dermaceuticals Hyla Active 3D sculptured masks, because all of these agents are going to block the light from actually penetrating into the skin. So as part of our clinicals, what we've been able to prove and show that with the Hydrogel mask application underneath the DP Dermaceuticals LED, we can enhance the overall phototherapy response. We can furthermore allow for greater firming, hydration, nourishment of the skin, better absorption of the active ingredients, but the physical design allows for the actives to get into the skin, but for the light to pass through. So it's not being blocked for this. So as a hydrogel mask, we have a very, very light hydrogel formula, which is applied onto the skin. And then we just simply remove our protective coat. And you'll notice that the hydrogel sitting underneath is a clear, transparent, gellous solution here. So it easily applies to the skin, but easily allows for the light to still pass, but to promote penetration. So it comes in two parts. There is the mouth, chin and jawline, and then the lower cheeks. And then there is the top part of the mask, which allows for treatment of the forehead and also of the eye area as well. So we apply the second mask as part of this process. So the benefits of using this mask is that you've got two options. It will work for the face, but also for neck and decollete. It provides a barrier in between the skin and also your DP Dermaceuticals LED. So this enables better safety and purity, but you also have your CliniPrep solution that you can use. It serves as the ultimate booster upgrade for your procedures, but also it works synergistically with all of your DP Dermaceuticals. So this can be used as part of your formal clinic treatments. It can be used as a standalone treatment with just the mask, but likewise also the hydrogel mask, so the LumaFuse technology, can also be used to neutralize if you were doing a combination therapy with either Uber Pro or with the Uber MD. And again, just to reinforce that none of the classic DP Dermaceuticals masks are suitable for combination therapies because they will block the light. This is the same with any cream or gel mask that you have. So only working with LumaFuse technology, which is the Hydrogel. So what's contained within the mask is a combination of hyaluronic acid to maintain moisture, hydration, comfort, softening of the skin, and to reduce any signs of inflammation. Added niacinamide further promotes increased of barrier function, but also reduces inflammation and heat within the skin. And a potent blend of antioxidants, including tea leaf extract, ginger, and licorice root, which furthermore also allows as a tyrosinase inhibitor for treatment of any hyperpigmentation as well. To facilitate collagen, a combination of magnolia vine, but a combination also of Japanese gold thread. So this now works along with Dermapen, the mechanical stimulation of the collagen, the photobiomodulatory chemical response of stimulation for collagen via the LED light, but then also the actives that we are infusing, including your MG collection from DP Dermaceuticals, but of course also the Hydra Gel Mask as well. Furthermore, the addition of bergamot and chamomile to reduce any bacterial proliferation, in conjunction also with your CliniPrep solution, now creates the perfect post-op infusion with a pH of 6.5 that will also neutralize any of your uber peels. So looking at protocols, it's advisable to maximize your LED technology that the patient undergoes at least 3 procedures, 2 to 3 procedures every week. And then that is for a 4-week time period. So, as part of these treatment protocols, it means that you can prepare the skin for collagen activation and prepare the skin for treatments before Dermapen, before injectables, before laser, before chemical peels. But you can also use the DP Dermaceuticals L.E.D as a standalone procedure post-op following your procedures. So they can come in a few days after their procedure, then a few days after that to keep in with that treatment program. It's a very simple, fast process and probably would only take you about 20 minutes to perform. So cleanse the skin, remove all makeup and residues so that the light is able to penetrate with the tri-phase cleanser. You can do a light exfoliation with the DP Dermaceuticals Microderm Exfoliant, then disinfect and prepare the skin with the CliniPrep solution. Apply the LumaFuse mask onto the skin, which creates a barrier in between the skin, but also the LED. And then over the top goes the LED mask, and then we leave activate for a minimum of 10 minutes. Remove the mask, and then conclude with your standard post-op products from DP Dermaceuticals, vitamin-rich repair, and cover recover. So this is our standard treatment of just LED technology. if you are combining in with your Dermapen 4. First, once you have completed your full Dermapen procedure, remove any post-operative residue. So that means remove any blood and remove any remaining mesoglide just by using some CliniPrep solution, but also some gauze. Ensure that the skin is dry. If you have any remaining MG collection, just simply lightly massage and pat that into the skin. And this allows for infusion. And then apply your LumaFuse mask over the top, and then apply your LED and let activate for just 10 minutes. We then conclude, of course, with our standard post-op, as with all Dermapen procedures, never to be substituted, to ensure safety efficacy of vitamin-rich repair, followed by cover recover. If working in with the DP Dermaceuticals Uber peels, and ease of synergistic solutions. So following the Dermapen procedure, the same process, remove all treatment residue, all blood, all mesoglide. Redisinfect and use the CliniPrep solution to ensure that the residue is removed. Pat the skin dry. Then on that dry skin, you can apply your Uber Pro first and let activate for anywhere up to 3 minutes. If you're just using the Uber Pro, you can then apply your LumaFuse mask and then your LED mask over the top. But otherwise, if you're going to perform a double peel, then over the top or in place of your Uber Pro, you can use the Uber MD applied only with an Uber stick. Wait until the peel has frosted. Once this has occurred, there's no need to wash the peels off. Simply apply the LumaFuse mask over the top of the treatment area. Bearing in mind that it has a pH of 6.5, it will accelerate the neutralization and prepare the skin for the mask, the LED, to go on over the top. So smooth the LumaFuse mask into position, then apply the LED over the top, and then allow for its activation for at least 10 minutes. For removal, simply take the mask off and then remove any remaining residue with CliniPrep solution, and then conclude our treatment. Firstly, if there's any remaining MG collection, can be pressed into the skin or lightly massage. And then, as with all Dermapen procedures, the treatment finishes with vitamin-rich repair and cover recover. So we have options, but another option, if you choose to sell the Dermapen LED technology to your patient for home use, they can perform a few times as a week their own at-home facial to support skin integrity, functionality, and quality in between treatments. Cleanse their skin with Triphase Cleanser or the DP Dermaceuticals Clear Foam Cleanser. They can do a light exfoliation with the Microderm Exfoliant. So you can see that this is the perfect type of treatment before an event. Rinse away any residue from the Microderm Exfoliant. Apply your LumaFuse mask over the top. And then using the DP Dermaceuticals LED, let activate for a session of 10 minutes, and then conclude with an application of the appropriate DP Dermaceuticals corrector, followed by vitamin-rich repair, and then also followed by cover recover, particularly for the daytime. So you can see that these home care protocols can also reinforce what occurs in clinic. Before we finish up, I want to share with you some patient case studies. And these patient case studies have all been performed as part of the original clinical studies for the Omnilux and for the production of the DP Dermaceuticals L.E.D. So this is just LED. This is not any combination therapies with Dermapen. And in this case, this is just the Dermapen DP Dermaceuticals face LED that is being used. So for the first patient, and with all patients that I share with you, they have followed the standard procedure of 3 sessions per week for 4 weeks. So this is delivering 196 joules per centimeter squared of energy and biophotomodulation and rejuvenation within the skin. First patient for rhytids and telangiectasia, we can see before and after our 4-week program. The second patient for wrinkle reduction, again for our 4-week program. So 3 sessions a week for 4 weeks. That is 12 treatments in total. So again, no combination therapies. As we see with the first patient for facultative hyperpigmentation, that red LED does in fact contribute to a rebalancing of the melanogenesis process. So we can see these types of results with just LED by itself, but the addition of uber peeling, the addition of the MG collection, but also the addition of Dermapen now takes us to the next level of results. And finally, for telangiectasia and redness, following the standard patient program of 3 procedures per week, so just 10 minutes, half an hour per week for each of those procedures in total. And then for a 4-week time period, the reduction. So we see versatility for anti-aging, for collagen modulation, for scar tissue, for wrinkles, for hyperpigmentation, but also for telangiectasia. And finally, we see the benefit of the DP Dermaceuticals L.E.D for treatment around the eye area. The patient can keep their eyes open, and then also for combination indications, including facultative hyperpigmentation and redness. So with all of these treatment programs, 3 procedures a week for a 4-week time period. But now we have the capability as part of our combination therapies to add in our Dermapen 4, to add in the MG collection, and to also add in Uber Pro. That concludes the formal part of today's webinar. As I stop sharing my screen, I'm going to have a look at some of the questions which have come through, and that will see us finishing up on perfect time period for this. So when we have a look at the first question, this is one which I will answer directly. This is some additional information. Likewise, also, when we have a look at the second round of information, this is further adding into further. Okay. So the final question, so we've just had some information come up, and you will be able to see this as part of the open. So if you just go into the Q&A tab, you'll be able to see the information which has been contributed as part of today's webinar for that. So the question asks, what is the minimum dose that should be used in treatments with a product if additional CBD is used? There is no key answer for this because it's going to be based on patient by patient, but also based on their indication as well for this. So we understand that there are varying degrees and concentrations of the CBD from the products. The most concentrated, of course, is the CBD found in the elixir at 1,000 milligrams, and then also at 500. So the elixir is a product that can either be used just in clinic for its analgesic effect prior to treatment, but again, you can also choose whether you choose to sell this to the patient as part of their physical home care. So the general recommendation for this is if the patient feels that they need to use it, that their skin is dry, that their skin is irritated, then the CBD product. So we are using this without creating a therapeutic or a drug claim in this case. Otherwise, for patients with just a localized sensitivity, then we can use at a lower dose with daily use of something such as the Visage. So not all patients will necessarily like something that has a richer feel, such as the elixir, using that as a facial oil. Alternatively, that can be blended into a moisturizer for that. So once the patient feels that their skin is now going back into a rebalance, their skin is no longer irritated for that, then they can look at reducing either down the dose or just using consistently a product such as the Visage instead of using the CBD at 500 or 100 milligrams. So these products are for a cosmetic use at home as opposed to therapeutic claims for this as well. The final was just a thank you for today's session. That concludes all of our questions and answers. There's been some vital information that has been posted in the questions and answers, so I'm extremely appreciative for that. So please have a read through some of that. A huge thank you to the very dynamic team at C.B.D for supporting this webinar series and for the launch of the CBD and also for the LED. And a huge thank you to the very amazing Pete from Dermapen World, who has stayed up way past his bedtime in Australia to facilitate and to moderate today's sessions. I'm Dr. Andrew R. Christie Schwartz, and it has indeed been my absolute pleasure. And I look forward to catching up with you, hopefully in real life, exceptionally soon. But in the meantime, I look forward to sharing my next information in our next webinar. Thank you so much and have a great day.